Hello, my name is Jose Hernandez, and I wanted to talk about caring for someone at home who has dementia or cognitive changes and how to overcome some of the challenging behaviors that can occur. And what I mean by challenging behaviors is sometimes when you're caring for someone, they can be resistive, they can be agitated, they can get angry, they can be really aggressive sometimes or inappropriate. And so when you're caring for someone who has these type of behaviors, it can be very difficult and draining physically and emotionally. And so I wanted to touch on one of the key points that can help address and help you overcome and manage these challenge behaviors, which is having a consistent care team. Now, what I mean by having a consistent care team is by having the same people kind of do the same type of task. If you are the care partner, if you're the one, the primary person doing all the activities, then you're the main care team. Same thing like with the medical doctors, sometimes the physical therapist, visiting nurses, and so on. When you have a consistent team, it you learn your care partner, and so that's very important. So the first point is familiarity. When you have a consistent care team, you develop familiarity as a care partner and for your loved one who has dementia or cognitive changes. Dementia doesn't always affect memory. There's sometimes I have clients who know exactly who I am. They can recall everything we did in therapy, but the dementia is affecting different aspects of their brain and affect different things. Maybe they know who I am, they remember me, but it's affecting their communication area in their brain. But they remember who I am. They recognize me. So when you have a care team that's consistent, you develop familiarity. And if they're familiar with you and you're familiar with them, you're less likely to feel um, resistive or closed up. It's easy for you to open up a little bit more. The second point I wanted to talk about is preference. When you have a consistent care team, you start to learn preferences. Maybe they like taking showers at night, they don't like waking up early, they like waking up and eating right away. So if you have a care partner that gives them a shower in the morning, uh, they may not wake up very happy, and then the rest of the day is not a good day. This can go for a lot of different things: what to wear, what to put on the TV, what activities to do, because it's not always just watching TV. Which puzzles they like to do, which games they like to do, which conversations are easier to navigate through, and make them feel at ease, while which conversations tend to get them more anxious and agitated. Learning preferences is very important for uh, knowing what may trigger or not trigger certain behaviors. The other thing is routine. When you have a consistent care team, it's a lot easier to maintain a certain routine. If you're always changing who's the one taking care of somebody, then the routine is never going to really stick. You don't know their preferences. You don't know how to motivate them. You don't know how to uh, maybe if you they like a certain channel and they like to eat a certain thing, um, and then the channel's not where it wants to be, and the food is not done exactly how it needs to be. There goes the morning routine, and then now it's just difficult, you know. So a consistent care team has means you can have a it's easier to implement a consistent care routine. Now, the last one is communication. As I mentioned earlier, sometimes dementia doesn't always affect memory loss, or not in the way that we always think it does. And so communication tends to be something that can be affected. Yeah. Sometimes they become nonverbal. And so they have to communicate through other things. Maybe it's through grunts. Maybe it's through hand signs. Maybe it's through facial reactions, expressions. Maybe it's through taps, tapping. Three taps is yes, two taps is no. Certain things like that. I had this one person who was wouldn't talk, or they if they talked, they would repeat. They would repeat the words. Yes, 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 yes. They had those repetitive words. So if I asked them, where do you have pain? It says yes, 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 yes. That's how they would respond. And so if I tried to get them to walk, or if I tried to help them move around, they would kind of get stuck in those repetitive words. And so it's important to learn how to communicate with them, or how to ask things in a certain way so they wouldn't get stuck as easily. And it also helps you as a care partner. This particular client, when they would get stuck on those repetitive words, sometimes the family would get frustrated. You okay? Okay, you already said yes. We got it. And I would sometimes have to jump in and say it's okay. This is not something they're doing purposely. It's just a process that they're going through because of their dementia. And so when you have a consistent care team, you learn about these details in communication. What is normal? What isn't normal? So when you have a consistent care team, you're able to identify some of these things. They're already familiar with you. You know how to keep them calm. You know what to do to help them have a nicer day, as opposed to a bad day. You know how to keep a better routine. You know how to ask certain questions, or what to expect when communicating. And you're able to identify things that are not normal, that aren't as consistent. Um, so that's something that's really important for helping managing some of these challenging behaviors. I hope this is helpful. Please like and subscribe. I will keep trying to bring on some of this content related to some of these things. And so, if you have any questions or anything, post on the comments. What are some things that you noticed when you had a consistent care team? Or what are some things you noticed when you always had a different nurse or a different doctor? And so on, or even just a different care partner, or family members that came to visit. Uh, Thank you.